This could be a warning indication if you have a slight soreness in any of these areas of your body. The physicians reveal for the elderly. Have you ever experienced a slight soreness in a certain part of your body and persuaded yourself that it couldn't possibly be anything? When we are older, we have a tendency to ignore minor aches and pains. We are of the opinion that it is simply the effects of aging. Possibly, we had a bad night's sleep or lifted something that was too heavy the day before. However, here is the reality. Sometimes the slightest aches that occur in very particular locations are actually the early warning signs that your body is sending you. Moreover, the cost of disregarding them can be significantly higher than the majority of people are aware of. In this video, we are going to reveal 8 different regions of the body where even the slightest discomfort could be a sign of something dangerous. Possibly even something that could risk your life. In addition to illnesses such as heart disease, cancer, blood clots, and organ failure, each of these areas, which range from the upper abdomen to the back of the knee, is associated with these conditions. And despite the fact that the discomfort may appear to be very minor, the repercussions of ignoring it might be really significant. I want you to stay with me until the very end because you might recognize one of these signs in yourself or in someone you care about. In addition, being aware of when to take action could potentially save a life. It's time to get started. First and foremost, a severe pain in the upper abdomen. At first glance, a pain in your upper abdomen could appear to be nothing to worry about. It could be a mild case of indigestion or even something you ate. However, this kind of pain can sometimes be the initial indicator of pancreatic disorders, including pancreatic cancer, in older persons, particularly those who are over the age of 60. What makes this aching so difficult to diagnose is the fact that it is frequently ambiguous. It does not have a harsh sensation, and it does not necessarily correspond with a temperature or nausea. In the region right below your rib cage, you can experience what feels more like a dull pressure or a tugging sensation. Even after eating, some people are more aware of it. Those who are lying on their backs experience it as well. Whatever the case may be, it is not severe enough to cause alarm bells to ring. And this is precisely the reason why it is overlooked. It is possible to find the pancreas hidden below the stomach and early warning signals of a problem. They don't typically manifest themselves in conspicuous ways. In spite of this, medical professionals have observed time and again that a mild and persistent pain in the upper abdominal region is one of the first symptoms that patients describe experiencing in hindsight. Gerald, who was 72 years old at the time, was the individual in question. On one particular morning, he shared with his wife that he had been experiencing a peculiar sensation in his stomach. It was not quite pain, but rather a kind of pressure. It occurred to him that it could be heartburn. In spite of this, he finally brought it up during a routine exam after it had been going on and off for a few weeks after that. According to the results of a few tests that his physician performed, he was diagnosed with stage 1 pancreatic cancer within a week. They were quick to catch it. His life was spared by that anguish. In the event that the pain you are experiencing is consistent, dull, and does not disappear despite taking antacids or making changes to your diet, or if it radiates to your back, it is advisable to consult your physician about it. This is especially true if it is accompanied by other symptoms, such as a loss of appetite, an unexplained weight loss, or a change in the appearance of your stools. The peculiarity of the pancreas is that it is a very silent organ. In the event that it is in distress, it does not yell, it utters a word. Listening is another skill that you need to have. Consequently, this discomfort in the upper abdomen region, even if it appears to be of a mild nature, should never be dismissed as merely gas or as the result of aging. Do not let something that can be treated to develop into something life-threatening. In the event that the pain is continuous, out of the ordinary for you, or simply does not feel right in your stomach, whether it be physically or figuratively, you should not wait. It should be checked. It is possible that all that is required to rule out something is a straightforward scan or blood test. Take advantage of something early. Itching in the lower back is the second symptom. It is possible that a dull aching in your lower back is one of the most prevalent complaints among older adults. Nevertheless, it is also one of the symptoms that can be one of the most deceiving. We frequently believe that it is nothing more than stiffness, a poor mattress, or even a torn muscle as a result of doing something that we shouldn't have done. In a great number of instances, that is precisely what it is. But not all the time. When you have pain in your lower back, it may be trying to communicate with you about something much more serious. There is something that is not in the spine at all, but rather something that is deeper, such as your kidneys or even the abdominal aorta, which is the largest blood vessel in your body. Pain that is associated with the kidneys typically begins as a dull aching that is located right below the rib cage and to one side. It may feel as though it is coming from behind you, but the source is actually coming from within you. In the event that you are dealing with a kidney infection or even a kidney stone that is growing, the discomfort may become apparent in a silent manner. You might not have a temperature or a burning sensation when you use the restroom. All you might feel is an ache. Something that you become more aware of at night. Anything that continues appearing in the same location over and over again. When it comes to abdominal aortic aneurysm, there is some additional information that is even more important to be aware of. One of the most important arteries that travels through your chest and belly is called the aorta. It is possible for the walls of this artery to become impaired in certain elderly people, particularly men over the age of 65 who have a history of smoking or high blood pressure. It is possible that it will not create any noticeable symptoms at first, but rather a nagging pain in the back, which is frequently misunderstood as another condition, such as arthritis or a strained muscle. A guy named Frank, who was 79 years old, had been suffering with what he considered to be a minor form of sciatica for more than a year. When he bent over or stood for an extended period of time, he experienced a little discomfort that was intermittent in nature. His doctors discovered an aortic aneurysm while they were performing a regular scan for a problem that was unrelated to the condition. It was getting near to bursting, but it hadn't already done so. It was only the pain in his back that had been a clue before. This kind of disease frequently manifests itself in a quiet manner. They do not begin with a bang, but if they are allowed to continue unchecked, they can rapidly advance and quickly pose a threat to one's life. Because of this, it is important to recognize the difference. In the event that your back pain is persistently located in the same area, does not improve with rest, or appears to be unrelated to any physical strain or injury, it is time to take a closer look at anything. In particular, if it is accompanied by additional changes, such as making it difficult to urinate, having blood in the urine, experiencing swelling in the legs, or having a pulsating sensation in the abdomen. The way in which your body responds to conventional medicines can sometimes be the most important clue. In the event that heat pads, stretching, or physical therapy are not relieving the pain, and the discomfort continues to return or increase, it is imperative that you take a step back and inquire whether this could be something more. A straightforward ultrasound or computed tomography scan can frequently detect these abnormalities at an earlier stage. There is no need to speculate, and early detection is the most important factor in determining the outcome. The management of kidney health, the removal of a stone, and the monitoring of an aneurysm before it becomes harmful are all examples of interventions. As we get older, we spend a significant amount of time learning how to deal with discomfort. However, not every difficulty calls for patience. Some people are deserving of our attention, particularly when they are attempting to shield us from something much more dangerous. Since you are familiar with your body, pay particular attention to any sensations that arise in your lower back that are unfamiliar, new, or persistent. It is possible that a quiet aching is a silent warning. I would appreciate it if you could use the second comment section below to let me know that you are continuing viewing this video and that you are finding these insights to be helpful. I strongly suggest that you subscribe to the channel and activate the bell if you have not already done so. This will ensure that you do not miss any videos. With your assistance, we are able to continue producing high-quality content that will both inform and inspire you. Let's proceed with our plans now. The third symptom described is a pain in the middle of the chest. At first, it might feel like a tightness, but it won't be crushing. It won't be acute, and it won't be dramatic. It might just be a dull, mild pain right in the middle of your chest. There are a few situations in which you might experience this, such as when you are climbing stairs, when you are walking after eating, or even when you are simply sitting in your favorite chair. This kind of chest tightness is something that many people who are older tend to dismiss as unimportant. Nevertheless, medical professionals caution that this very sensation is frequently the initial indication of something much more serious, such as angina or the beginning stages of heart disease. The chest pain that is caused by the heart is not always severe. There are times when it does not even feel like an elephant is resting on your chest. In point of fact, the symptoms of some of the most deadly heart disorders begin with nothing more than a feeling of constriction, heaviness, or pressure that lasts for a few minutes and then disappears. Ignoring it because they believe it is gas, muscle strain, or simply a side effect of age is the reason why so many people ignore it. A woman by the name of Marlene, who was 74 years old, started experiencing this kind of difficulty every morning when she walked to her mailbox. The discomfort was not severe, rather, it was just enough to cause her to pause and take a breath. While she was getting her annual checkup, she made a passing reference to it, not giving it any thought. It was determined that she had severe narrowing in two of her coronary arteries, which was the reason why her physician recommended that she undergo a stress test. Before she suffered a heart attack, they sought treatment for it. The warning was that nagging pain in the back. The condition known as angina is characterized by the fact that your heart is not receiving the necessary amount of blood during times of exercise or stress. Blood that is high in oxygen, even if it is not yet failing, it is having a difficult time. And the only way that your body can communicate with you is by causing you to feel discomfort in the middle of your chest. This is the only way that it can communicate with you. This type of discomfort may also radiate to other areas. There are occasions when it travels to your shoulders, arms, neck, or jaw. At other times, it seems as though it is simply sitting there, not doing much, but coming back at the same times every day. It is one of the most obvious indications that something is going on when you see that pattern. That repeated suffering. If you are experiencing this pain in conjunction with other minor symptoms, such as shortness of breath, weariness, lightheadedness, or a cold sweat, it is very crucial to pay attention to these symptoms. Although it may be simple to disregard these symptoms on their own, it is imperative that you pay close attention to them when they are accompanied with even the slightest amount of chest tightness. Another important point to keep in mind is that older folks, particularly women, frequently experience heart symptoms in a manner that is distinct from that of younger people. It's possible that what you think is indigestion, worry, or even a pinched nerve is actually your heart trying to tell you that it's in difficulty. Because of this, it is really crucial to check out as soon as possible, to determine whether or not there are any indicators of inflammation or injury. Your physician may carry out a few fundamental procedures, such as an electrocardiogram, a stress test, or a straightforward blood draw. In no way is any of it intrusive. In addition to the advantage of catching it early, all of it has the potential to provide valuable information. Before it develops into a heart attack, you have the ability to address it. It is possible to make tiny alterations to your lifestyle, take straightforward drugs, or go through a short operation that could provide you with years of living that is both stronger and safer. Therefore, if you experience that tightness, that heaviness, or that dull ache that seems to arrive at the same times or under the same situations, you should not wait for it to become unbearable. You should not wait until you are unable to ignore it any longer, since at that time it might already be too late. In certain cases, the heart does not yell out. Some of the time, it will simply gently and silently prod you in the hopes that you would pay attention to it before it is compelled to scream. The fourth symptom is a pain in the left shoulder or the forehead. It is common for people to anticipate that the pain will be felt in the chest when it comes to heart problems. The heart, on the other hand, does not always follow the rules, which is something that a lot of people who are older don't comprehend. There are occasions when the first location it sends its distress signal is somewhere completely unexpected, such as the jaw or the left shoulder. It is possible that you are going about your day, chewing your meal, or conversing on the phone when all of a sudden you feel a dull ache in your jaw that is persistent and bothersome. It's also possible that your left shoulder starts to hurt after you've carried a bag of shopping for a while. Not in a harsh or unpleasant manner, but in a manner that causes you to take notice. Those of you who have experienced this and attributed it to factors such as tension, arthritis, or simply old joints playing up, know that you are not alone. But it's also possible that you failed to recognize a clue that your heart was pleading for assistance. Referred pain is one of the characteristics of cardiac symptoms that is misinterpreted the most than any other. It is possible for the heart to experience discomfort in areas that appear to be unconnected when it is under stress as a result of issues such as clogged arteries, reduced blood flow, or even the early stages of a heart attack. Jaw and shoulder, particularly on the left side, are two of the most prevalent areas affected by this condition. The story of a woman named Linda, who was 68 years old at the time, is well known. She went to her dentist because she had been experiencing a peculiar pain in her lower jaw for a period of 2 weeks. In terms of her teeth, there was absolutely no problem, not a single infection, and no dental issues. However, her dentist, who has experience with situations similar to this one, advised her to consult with a cardiologist. She was receiving treatment for substantial coronary artery disease within a week after being diagnosed with it. The left shoulder is also affected in the same way. A persistent aching that does not appear to be related to movement, does not improve with rest, and does not react to the typical therapies for arthritis or strain, particularly if it comes on with light exertion, may be the heart's way of calling attention to a potential problem. It is common for this kind of pain to be covert. It is not very crisp, despite the fact that it does not halt you in your tracks. It does come back, perhaps not every day, but frequently enough that it grows familiar to you. When it is accompanied by other mild symptoms, such as shortness of breath, exhaustion, or a peculiar sensation of disquiet, it is time to pay attention to what someone is saying. This is something that is specifically emphasized by medical professionals, particularly for women, who are more likely than men to develop non-traditional cardiac symptoms. The discomfort in the jaw, the pain in the neck, and the aches in the shoulders are all symptoms that, when viewed alone, may not appear to be extremely concerning, yet, when taken collectively, they create a totally different image. You could be thinking, I've experienced pain like this before. Not so. It is reasonable. However, this is about what is new, what is distinct, and what does not match the general patterns that are typically seen. If you are experiencing pain in your jaw even when you are not chewing, or if your shoulder hurts even when you have not lifted anything, these are the types of aches that are significant. Notice how soon the discomfort goes away when you rest. This is another key thing to keep in mind. When the heart is no longer under stress, the discomfort that is associated with the heart begins to decrease. It is for this reason that persons who suffer from angina frequently discover that their agony goes away when they stop walking or climbing stairs. If you are able to get rid of the pain by resting, but it returns when you exert yourself, this is a clear indication. Having a brief discussion with your physician, an easy cardiac test, or even an electrocardiogram can frequently eliminate the possibility of a serious condition. But you don't want to take the risk of waiting, guessing, or hoping that it will disappear on its own, because it's definitely a gamble. When your jaw or shoulder tells you that something feels strange, even in the slightest degree, listen to it. You have lived long enough to have the ability to trust your gut instincts for a reason. I would appreciate it if you could use the fourth comment section below to let me know that you are continuing viewing this video and that you are finding these insights to be helpful. I strongly suggest that you subscribe to the channel and activate the bell if you have not already done so. This will ensure that you do not miss any videos. With your assistance, we are able to continue producing high-quality content that will both inform and inspire you. Let's proceed with our plans now. The fifth symptom is a pain in the lower right abdominal region. There is a really particular form of pain that manifests itself in the lower right quadrant of your abdominal territory. In other words, it does not demand attention, in spite of the fact that it is not acute enough to knock you over. It is persistent, it is peculiar, and it has a way of giving you the impression that something is not quite right down there. This seemingly insignificant discomfort may be an indication of something more serious than people typically believe, such as appendicitis or, in certain instances, a hidden problem in the bowel that is slowly festering under the surface. This is especially true for elderly folks. It is true that appendicitis is more prevalent in younger people, but the majority of people believe that it is a disorder that affects young people. But it is possible and does occur at a later stage in life. On the other hand, the symptoms that are experienced by elderly people are typically far less obvious. A pain that lingers around your lower right abdomen, possibly coming and going, and possibly getting worse when you press on it or move about too rapidly is all that you are experiencing. There is no fever or vomiting. For about 2 weeks, a man named Alan, who was 76 years old, had been experiencing a little soreness in that particular location. He was under the impression that it would disappear on its own. The fact that he had not consumed anything peculiar, that he was not experiencing constipation, and that he did not have a fever led him to believe that it was simply a muscle strain. When he entered the room, the appendix had not yet ruptured, although it was quite close to doing so. According to the surgeon, if he had delayed even one more day, the outcome might have been drastically different. However, this is when things come to a more worrying turn. It is also possible for symptoms to manifest in the same region of the abdomen when there is a problem with the intestines, namely the cecum, which is the first segment of the large intestine. Even in the early stages of colon cancer, conditions such as cecal volvulus, diverticulitis, or even colon cancer might begin with little more than a dull discomfort. It's just that constant low aching that you can't quite describe. There is no blood, and there are no dramatic changes in terms of digestion. When it comes to timing, intensity is not the only factor to consider. When the discomfort occurs after meals or when it is accompanied by bloating, cramping, or a feeling of fullness, even when you haven't eaten much, these are indications that your stomach is trying to alert you to something. And let's not forget that as we get older, our bodies undergo changes. Symptoms do not always follow the textbook. Nerves are not always as reactive. Immunological responses are slower, and nerves are not always as reactive. Because of this, we need to become our own greatest observers, paying attention to patterns rather than just the amount of discomfort we are experiencing. Because lower right abdomen pain can often be misconstrued as gynecological concerns and vice versa. Women in particular need to exercise an extra degree of caution when it comes to this particular region. It is possible for ovarian cysts, infections, and other disorders to all radiate discomfort in a similar manner. In the event that the pain is fresh, does not disappear, and is perceived as more than a fleeting inconvenience, it is time to voice your concerns. Imaging tests, such as a CT scan or an ultrasound, may be recommended by your physician. Simple tests that do not involve any intrusive procedures can provide you with peace of mind or assist you in detecting anything early on while it is still controllable. And here's the most important thing. Don't minimize it just because it doesn't feel as horrible as it should. Even if the stomach discomfort is not severe, it can still be a problem, particularly if it has been present for a longer period of time than it should have been. My sixth complaint is a pain behind the knee. Having a slight tightness or pain below the knee is something that is simple to miss. It's possible that you twisted it incorrectly. You might have sat for too long. It could be that it's just one of those aches that pop up and disappear. Nevertheless, there is a particular ailment that medical professionals warn older folks about. And it frequently begins just there, behind the knee, with little more than a persistent, nagging discomfort. This condition is known as deep vein thrombosis, better known as DVT. Blood clots in deep veins, most frequently found in the legs, are the cause of deep vein thrombosis, DVT. In addition, although it is possible for it to occur without any pain at all, one of the initial indicators, particularly in older folks, is a persistent ache in the lower thigh or behind the knee that does not go away no matter what you do. You might not feel any discomfort when you touch it. It is possible that it may not swell at first, but it will continue to stay, and it will feel a little bit strange. This location is particularly hazardous due to the fact that blood clots that form in the legs have the potential to become dislodged, move to the lungs, and result in a pulmonary embolism, which is a potentially fatal obstruction that frequently occurs without any prior preparation. However, prior to that happening, the body does provide us with indications. It is essential to be aware of what to search for. An individual by the name of Richard, who was 81 years old, became aware of a discomfort behind his right knee. He disregarded it because he believed it was a result of traveling for quite a long distance. Nevertheless, after a few days, the leg began to show signs of minor swelling. Even yet, he did not consider it to be a major matter. It was on the fourth day that he became exhausted while climbing the stairs. The fact that he went to see his doctor was sufficient for him. The findings were confirmed by blood testing and a brief scan. Clots had begun to form. The medication was able to clear it up after it was caught in time. But things might have turned out differently if he had waited for a longer period of time. The manner that deep vein thrombosis, DVT, feels is frequently what differentiates it from other types of leg discomfort. That is not abrupt or sudden at all. By bending your knee, walking, or applying pressure to the area, you will feel something that is more akin to a pressure or a heavy feeling. When you touch it, it can sometimes feel warm. Occasionally, the skin seems to be significantly darker or slightly redder than the opposite leg. On the other hand, there are times when you are unable to perceive anything but that ache that just won't go away. DVT is more likely to occur in older persons for a number of different causes. A decrease in circulation, a decrease in movement, surgical procedures, drugs, or even just sitting for extended periods of time while traveling. Each of these elements can subtly increase the likelihood of a blood clot occurring. The chance of developing deep vein thrombosis, DVT, increases with age. Particularly if you have a history of smoking, high blood pressure, or previous vein problems. Younger people are also susceptible to developing DVT. Catching it early, before the clot forms and before it travels, is the most important thing to do. Do not wait if the pain is chronic, if one leg feels different from the other, or if you have been inactive for a period of time and now feel a strange stiffness or soreness behind the knee. All of these symptoms indicate that you should seek medical attention immediately. If you want to check for clots, your doctor can request a fast ultrasound, which can typically be performed quickly in the office. Additionally, if you are someone who travels frequently or sits for lengthy periods of time, you should get up and move around every hour. Make sure your legs are stretched out, flex your ankles, and keep your blood going. In terms of effectiveness, prevention is on par with therapy. That slight discomfort behind your knee could not be anything at all. However, if it is not, and if it is a clot that is building deep within your leg, it is something that you should be aware of before it reveals itself to you in a painful manner. I would appreciate it if you could use the 6th comment section below to let me know that you are continuing viewing this video and that you are finding these insights to be helpful. I strongly suggest that you subscribe to the channel and activate the bell if you have not already done so. This will ensure that you do not miss any videos. With your assistance, we are able to continue producing high-quality content that will both inform and inspire you. Let's proceed with our plans now. Pain in the groin or pelvic region. This is the 7th symptom. In the event that you have a slight discomfort or pressure in the region of your pelvis, particularly as you become older, it is tempting to dismiss it as nothing. It's possible that you believe it's a pulled muscle because you got out of the car in the wrong direction, or that it's tightness because you sat for too long. However, if the pain persists in the pelvis or groin, particularly if it does not improve with time or if it does not appear to be associated to movement, it may be your body's subtle way of indicating that there is something far more significant going on. If you are an older man, experiencing discomfort of this nature may be an early indicator of prostate problems. Perhaps it is not a severe pain at all. Simply put, it could feel like you're full. In example, when sitting, a gentle pressure may be applied, and in many cases, it manifests itself a long time before the more common symptoms of prostate problems, such as having trouble peeing or having to go to the toilet frequently during the night. According to a man named Dennis, who is 75 years old, he first experienced what he described as a dull, low pain whenever he sat on a hard chair for an extended period of time. It did not cause any discomfort in his day-to-day life. It did not cause any disruptions. Something about it, however, seemed to be odd. After he had ignored it for a number of months, his daughter insisted that he get it checked out. His prostate was found to be enlarged, and there were early indications of malignant alterations. According to the tests, it was discovered early on, so he had options available to him. In addition to that, he was able to cure it before it spread. Also, it is not limited to the prostate alone. The presence of pelvic discomfort in both men and women may be an indication of bladder disorders, hernias, or even some types of cancer, such as cancer of the bladder, cancer of the ovary, or cancer of the rectal region. In addition, the majority of the time, these do not start with sudden symptoms. They begin with that one very slight aching that occurs in the same location over and over again. When it comes to this situation, you are searching for a sense of constancy. Is the pain always there in the same region, and does it come back day after day? Does it feel more interior? That is, more profound than muscle strain? Is it accompanied by additional symptoms, such as alterations in the way you use the restroom, blood in the urine, pressure when you sit, or a feeling that you are not completely emptying your bladder? These mild symptoms frequently manifest themselves a significant amount of time before any diagnosis is made. This is an area that should not be ignored by women, particularly those who have gone through the postmenopausal transition. When the discomfort in the lower abdomen or groin is minor, it can be an early indicator of changes in the bladder, uterus, or ovaries. This is especially true when the discomfort is severe. In this context, the most important takeaway is that pelvic discomfort can be easily alleviated. You will not be prevented from walking by them. They do not cause you to scream out in agony. Simply put, they stand about. But when something is wrong in that portion of the body, your internal organs, which are densely packed and profoundly connected, will frequently send out early warnings that are easy to miss if you are not paying attention to them. In order to assist in determining the root of the problem, your physician may perform a physical examination, blood tests, and imaging procedures such as CT scans or ultrasounds. For the most part, it is not an urgent matter. On the other hand, there are occasions when it is the beginning of something that you will want to catch as soon as possible. If you have had a pain in the pelvic or groin region that does not go away after rest, is not associated with movement, or comes with other minor indicators, you should not wait for it to become something more serious. In this life, you have come too far to ignore the early signals that your body is giving you. This has nothing to do with paranoia. It's about taking the initiative now. Also, at this point in your life, being proactive is one of the best presents you can offer to yourself, you can give yourself. In conclusion, as we get older, It is simple to disregard small aches and pains simply because they are a natural part of the aging process. Nevertheless, your body is frequently attempting to communicate with you. There are instances when seemingly insignificant annoyances, such as the ones we've talked about today, can be the first indications of more serious and potentially fatal disorders. In the beginning, it could appear that ignoring them is not harmful, but taking action sooner rather than later can make a significant difference in your overall health and well-being. If you are experiencing discomfort in your body, whether it be stomach pain, a peculiar ache in your chest, or a nagging soreness in your pelvis, you should pay attention to it. It is not a good idea to wait for the pain to get more severe or for a condition to progress further. People's lives can be saved by early detection, straightforward diagnostics, and frequent examinations. It is possible to continue to live a life that is full of vitality and health far into your senior years if you take preventative measures and pay attention to your body. We appreciate you being here with us today. It would be wonderful if you could get in touch with us. Please leave a comment below and tell us about one item you discovered today and how you intend to put it to use in your life right now. We place a high value on your opinions, so please do not be reluctant to share them with us. Our inspiration and encouragement are greatly increased as a result of reading your remarks. I would appreciate it if you would like, subscribe, and share this video if you found it to be informative and enjoyable. With your assistance, we are able to continue producing high-quality content that will both inform and inspire you. We appreciate you taking the time to watch, and we hope to see you in the future video.